Thank you, Madam President. I come to the floor to speak about the ongoing crisis of the novel coronavirus outbreak and to urge all of us to pass this supplemental as quickly as possible. As of this morning, there are 163 confirmed cases in 17 states across the country, but no state has been more hard hit than the state of Washington. We now have 39 confirmed cases of COVID-19 and more than 230 people under public health monitoring. We have lost 10 of our citizens, and our thoughts and prayers are with those families who've lost loved ones, or still families who have those in a nursing home that they are trying to make sure get the appropriate care in this ongoing crisis. I'd also like to thank the workers who are on the front lines of this healthcare crisis, who are doing everything they can to help keep our citizens safe. What's clear in this supplemental is that we need more resources for testing. That testing capabilities will help our communities understand the community transfer of this virus and what else we need to do to help stop its spread. Some of the funding in this supplemental can be helpful for our smaller public labs to do more testing, to help our public health officials respond to this crisis, and as I've urged yesterday, for the CDC and others to make it clear through our public health sites exactly how the public can go about getting access to testing. This is so critical because I know there are people in the state of Washington who feel ill, who feel like they might be subject to this coronavirus and aren't getting tested. We want to make sure that the public clearly understands what their paths are for getting those tests. And we want to make sure that every lab, commercial and academic, in the United States is getting prepared to help us in the advent of the spread of this virus. Why? Because helping to identify these early cases is what will help us be successful in understanding these patterns and further community separations that we need to do. Why is this so important? Well, today in the state of Washington, they are taking major steps. Major employers are encouraging, if possible, their employees to work from home. These are companies like Microsoft and Facebook and Amazon, major employers. We have 23 schools who have closed and 2 school districts who are entirely shut down. Why are they doing this? Because they're taking the precautions of people that have been exposed to the coronavirus in those schools, and they're doing everything they can to make sure that they respond correctly. In addition, King County has recommended that anyone over the age of 60 or anyone with a pre-existing medical condition who is pregnant should avoid public places and gatherings as much as possible. We're taking all these steps now because we are at the epicenter of this crisis. But I want people to know that there are other things that other states can be doing to learn from what we've done in Washington. The fact that we had a flu lab that actually was a collaboration between our academic and scientific and health communities to get people who thought they just simply had the flu to also be tested, we found cases of the coronavirus. That actually is something you have to set up and get permission for. So I hope that every state will follow suit and set up such a cohort of people working together to share that information so that we can help prevent the spread. Washington State will receive $11.5 million in funding to help the Department of Health respond to this crisis. I know the Vice President is visiting our governor in Olympia, Washington today. And I hope that these funds in this bill that we are passing today will increase access for public lab testing, help pay for isolation and quarantine, help pay for sanitizing in public areas, better track the virus and those who might come into contact with it, help labs who are trying to identify hot spots and to limit exposure. As part of this package, Washington State will also be helped by the reimbursements with reimbursements since the outbreak of this cost, and I can tell you they are many, and to help us push through the things that are protocols that will help establish better responses. Yesterday, we had a hearing in the Aviation Subcommittee to talk about what is needed for an aviation protocol. I know that some airlines in our state are doing everything possible to clean planes on every turn of the trip and to do deep cleaning. They're communicating, and we've encouraged them to communicate more to their passengers exactly what they are doing to help in mitigation of this virus. But that is not a substitute for the Department of the Transportation federally and the CDC collaboratively to work in giving guidance to airlines on what standards they should be meeting to help mitigate the spread of this virus. My colleagues and I are calling on them to do that, and not simply to think of this as others' agencies' responsibilities, but work collaboratively to get this done. So I want to thank the Appropriations Committee for getting this legislation to us today, and all our colleagues who have worked so quickly on making it happen. But I can tell you, we need these funds, we need them now, and we need other states to heed the early testing that would have been helpful in our state and now may be helpful in yours. Let's get as aggressive about testing as possible. Let's get aggressive about sharing information about flu and tracking this virus. Let's get aggressive about trying to mitigate the impacts of this deadly disease. I thank the President, and I yield the floor.